Hello everyone, and welcome. Today we're talking about one of the most important health topics affecting millions of people across the United States and around the world: heart disease. Many people believe heart disease only affects older adults, but the truth is that it can develop silently over many years, often without causing obvious symptoms in the beginning. By the time some people discover they have heart disease, they may already be experiencing a heart attack, heart failure, or another serious complication. The good news is that heart disease is often preventable, and in many cases, early detection combined with healthy lifestyle changes can make a significant difference. Understanding the warning signs, knowing the risk factors, and making informed decisions about your health can help you protect one of the most important organs in your body, your heart. This video is designed to provide educational information about heart disease, its warning signs, common risk factors, and practical ways to reduce your risk. It is not intended to replace professional medical advice. If you experience concerning symptoms or have questions about your health, always consult a qualified healthcare professional. Let's begin by understanding what the heart actually does. Your heart is a remarkable muscle, about the size of your fist, located slightly to the left side of your chest. Every minute of every day, it pumps blood throughout your body, delivering oxygen and nutrients to your organs, muscles, and tissues while removing waste products. An average heart beats around 100,000 times every single day and pumps thousands of gallons of blood each week. Despite working continuously throughout your life, the heart often receives very little attention until something goes wrong. Heart disease is not a single condition. Instead, it is a term used to describe several different disorders that affect the heart and blood vessels. The most common type is coronary artery disease. This occurs when the arteries that supply blood to the heart become narrowed or blocked by fatty deposits known as plaque. Plaque develops gradually over many years. It contains cholesterol, fat, calcium, and other substances found in the blood. As plaque builds up, the arteries become narrower, making it harder for blood to reach the heart muscle. This process is called atherosclerosis. At first, you may not notice any symptoms at all. The body often compensates for reduced blood flow, allowing many people to continue their normal activities without realizing anything is wrong. However, as the blockage becomes more severe, the heart begins to struggle to receive enough oxygen, especially during physical activity or emotional stress. If a plaque suddenly ruptures, a blood clot may form and completely block blood flow to part of the heart muscle. When this happens, a heart attack can occur. Without immediate medical treatment, heart muscle begins to die due to lack of oxygen. This is one reason why understanding early warning signs is so important. Heart disease remains the leading cause of death in the United States. According to national public health data, hundreds of thousands of Americans die from heart disease every year. Millions more live with heart-related conditions that affect their daily lives. Yet many of these cases are linked to risk factors that can often be managed through healthier habits and regular medical care. One of the biggest challenges with heart disease is that it usually develops slowly. Unlike an injury that happens suddenly, heart disease often progresses silently over decades. During this time, many people feel perfectly healthy. That's why prevention is so important. The choices you make every day, what you eat, how active you are, whether you smoke, how well you manage stress, and whether you keep your blood pressure, cholesterol, and blood sugar under control, all play an important role in protecting your heart. Now let's discuss some of the earliest warning signs that should never be ignored. One of the most common symptoms is chest discomfort. Many people imagine a heart attack as sudden, severe chest pain. While that can happen, heart disease often begins with milder symptoms. You may notice pressure, tightness, squeezing, fullness, or discomfort in the center of your chest. Some people describe it as feeling like a heavy weight sitting on their chest. Others say it feels like burning, aching, or unusual pressure. The discomfort may come and go. It may appear during exercise, climbing stairs, carrying groceries, or even during emotional stress. Sometimes it improves after resting. Although chest discomfort does not always mean heart disease, persistent or recurring chest pain should never be ignored. Another important warning sign is shortness of breath. If you become unusually breathless while performing activities that were once easy, such as walking, climbing stairs, or doing household chores, your heart may not be pumping blood efficiently. Some people even experience shortness of breath while lying down or during sleep. Fatigue is another symptom that many people overlook. Everyone feels tired occasionally. However, unusual fatigue that continues for days or weeks without a clear reason may indicate that your heart is working harder than normal to pump blood throughout your body. Some people notice they no longer have the energy to complete simple daily activities. Others find themselves needing frequent rest breaks after tasks that never used to be difficult. This type of persistent fatigue deserves medical attention, especially when combined with other symptoms. Pain that spreads beyond the chest can also be a warning sign. Heart-related discomfort may travel to the left arm, both arms, shoulders, neck, jaw, upper back, or even the upper stomach. In some cases, especially among women, jaw pain, neck pain, upper back discomfort, nausea, or unusual fatigue may be more noticeable than chest pain itself. These symptoms should never be dismissed simply because they don't match the classic image of a heart attack. Many people also experience dizziness or lightheadedness. If your heart is unable to pump enough blood to your brain, you may feel faint, dizzy, or unsteady. While dizziness has many possible causes, repeated episodes should always be discussed with a healthcare provider. Swelling in the feet, ankles, or legs can sometimes indicate heart failure. When the heart cannot pump efficiently, fluid may begin to accumulate in different parts of the body, causing noticeable swelling. Some people also notice rapid weight gain over a short period due to fluid retention. Persistent coughing, especially when accompanied by pink or white frothy mucus, may also occur in certain forms of heart failure because fluid begins collecting in the lungs. Many people are surprised to learn that heart disease doesn't always cause dramatic symptoms in the beginning. In fact, some people live with blocked arteries for years without realizing it. That's why regular medical checkups are so important, especially if you have risk factors such as high blood pressure, high cholesterol, diabetes, obesity, or a family history of heart disease. Let's take a closer look at the factors that increase your risk. Age is one of the most significant risk factors. As we grow older, our arteries naturally become less flexible, and plaque has had more time to build up. However, heart disease is no longer limited to older adults. Doctors are seeing increasing numbers of younger adults diagnosed with cardiovascular disease due to unhealthy lifestyles. Family history also plays an important role. If your parents, brothers, or sisters developed heart disease at an early age, your own risk may be higher. While you can't change your genetics, you can control many other factors that influence your heart health. High blood pressure is often called the silent killer because it usually causes no symptoms until significant damage has already occurred. Constantly elevated blood pressure forces your heart to work harder, gradually damaging the arteries and increasing the risk of heart attack, stroke, and heart failure. High cholesterol is another major contributor. Cholesterol itself is essential for the body, but too much LDL cholesterol, often called bad cholesterol, can accumulate inside artery walls, forming plaque that restricts blood flow. HDL cholesterol, often called good cholesterol, helps remove excess cholesterol from the bloodstream. Maintaining healthy cholesterol levels is one of the most effective ways to reduce your cardiovascular risk. Diabetes is another condition that greatly increases the risk of heart disease. High blood sugar can damage blood vessels and nerves over time, making it easier for plaque to develop inside the arteries. People with diabetes are much more likely to experience heart attacks and strokes than those without diabetes. Smoking remains one of the most preventable causes of heart disease. Every cigarette exposes your blood vessels to harmful chemicals that damage the artery walls, reduce oxygen in the blood, increase blood pressure, and make blood clots more likely to form. The encouraging news is that quitting smoking begins to benefit your heart almost immediately, and the health benefits continue to increase over time. Physical inactivity is another common risk factor. Modern lifestyles often involve long hours of sitting at work, driving, or watching television. Regular physical activity helps strengthen the heart muscle, improve circulation, lower blood pressure, manage weight, and reduce stress. Even moderate exercise, such as brisk walking for about 30 minutes most days of the week, can provide substantial cardiovascular benefits. Being overweight or obese places additional strain on the heart. Excess body weight is often associated with high blood pressure, diabetes, high cholesterol, and inflammation, all of which increase the risk of heart disease. Even modest weight loss can improve heart health if you are overweight. Chronic stress also affects the heart. While occasional stress is a normal part of life, long-term stress may contribute to unhealthy behaviors such as overeating, smoking, poor sleep, or excessive alcohol consumption. Stress hormones can also temporarily raise blood pressure and heart rate. Learning healthy ways to manage stress, including exercise, relaxation techniques, hobbies, and spending time with loved ones, can support both your mental and physical health. Now let's talk about nutrition. What you eat every day has a powerful influence on your heart. A heart-healthy eating pattern focuses on foods that provide vitamins, minerals, fiber, and healthy fats, while limiting foods that are high in saturated fat, trans fat, sodium, and added sugars. Fresh vegetables should make up a large portion of your meals. Leafy greens such as spinach, kale, and lettuce contain nutrients that support healthy blood vessels and overall cardiovascular function. Colorful vegetables like carrots, broccoli, bell peppers, tomatoes, and Brussels sprouts provide antioxidants that help protect cells from damage. Fresh fruits are another excellent choice. Berries, apples, oranges, bananas, grapes, and citrus fruits contain fiber, vitamins, and natural plant compounds associated with better heart health. Whole grains are healthier than refined grains because they contain more fiber and nutrients. Foods such as oatmeal, brown rice, quinoa, and whole wheat bread can help support healthy cholesterol levels. Lean sources of protein are also important. Fish, especially fatty fish like salmon, sardines, trout, and mackerel, contain omega-3 fatty acids that support cardiovascular health. Skinless chicken, turkey, beans, lentils, and tofu are also nutritious protein options. Healthy fats should replace unhealthy fats whenever possible. Foods such as avocados, walnuts, almonds, pistachios, flax seeds, chia seeds, and olive oil provide beneficial fats that may help improve cholesterol levels when eaten in moderation. At the same time, it's important to limit foods that may increase cardiovascular risk. Highly processed foods often contain excessive sodium, unhealthy fats, and added sugars. Fast food, fried foods, processed meats such as bacon, sausage, hot dogs, and deli meats should be eaten only occasionally, if at all. Sugary drinks, including regular soda, sweetened juices, and energy drinks, can contribute to weight gain and increase the risk of diabetes and heart disease. Too much salt may contribute to high blood pressure. Reading nutrition labels and choosing lower sodium options can help protect your heart. Alcohol should also be consumed carefully. Excessive alcohol intake may increase blood pressure, contribute to irregular heart rhythms, and add unnecessary calories. If you choose to drink alcohol, follow your healthcare provider's guidance and current public health recommendations. One simple habit that many people overlook is staying hydrated. Drinking enough water helps support normal body functions, although hydration alone does not prevent heart disease. Replacing sugary beverages with water is often a positive step toward better overall health. Sleep is another critical part of heart health. Adults generally benefit from getting enough quality sleep each night. Poor sleep over long periods has been associated with increased risks of high blood pressure, obesity, diabetes, and heart disease. Developing a consistent bedtime routine, limiting screen time before bed, and creating a comfortable sleep environment may improve sleep quality. Exercise is one of the most powerful tools for protecting your heart. The good news is that you don't need to become a marathon runner to improve your cardiovascular health. Small, consistent changes can have a meaningful impact. Health experts generally recommend that most adults aim for at least 150 minutes of moderate-intensity physical activity each week. This can include brisk walking, cycling, swimming, dancing, or any activity that raises your heart rate while allowing you to continue a conversation. If you're new to exercise, start slowly. Even a 10-minute walk after meals is better than doing nothing at all. As your fitness improves, you can gradually increase both the duration and intensity of your activity. Before beginning a new exercise program, especially if you have existing medical conditions, it's a good idea to speak with your healthcare provider. Regular exercise offers many benefits. It strengthens the heart muscle, improves circulation, lowers blood pressure, helps manage cholesterol levels, supports a healthy body weight, improves blood sugar control, reduces stress, and can even improve sleep quality. Routine medical checkups are another important part of prevention. Many of the biggest risk factors for heart disease, such as high blood pressure, high cholesterol, and diabetes, may not cause noticeable symptoms for years. Regular screenings can identify these conditions early, giving you the opportunity to manage them before they lead to serious complications. If your healthcare provider recommends blood tests, blood pressure monitoring, cholesterol screening, or diabetes testing, don't delay. These simple evaluations can provide valuable information about your cardiovascular health. Now let's address a few common myths about heart disease. The first myth is that heart disease only affects men. The truth is that heart disease is a leading cause of death for both men and women. While symptoms can sometimes differ between men and women, everyone should take heart health seriously. Another common myth is that if you feel fine, your heart must be healthy. Unfortunately, heart disease often develops silently. Many people have significant artery blockages without experiencing obvious symptoms until a major event such as a heart attack occurs. Another myth is that only overweight people develop heart disease. Although excess weight increases risk, people of normal weight can also develop cardiovascular disease due to genetics, smoking, diabetes, high cholesterol, high blood pressure, or other factors. Some people believe that taking medication alone is enough. While medications can be extremely important, they work best when combined with healthy eating, regular physical activity, avoiding tobacco, maintaining a healthy weight, getting enough sleep, and following your healthcare provider's recommendations. Now let's talk about symptoms that require immediate medical attention. If you or someone around you experiences severe chest pain or pressure that lasts several minutes or keeps returning, especially if it's accompanied by shortness of breath, pain spreading to the arm, shoulder, jaw, neck, or back, nausea, cold sweating, dizziness, or fainting, seek emergency medical care immediately. Time is critical during a heart attack. The sooner treatment begins, the greater the chance of protecting the heart muscle and improving recovery. Never try to drive yourself if you're experiencing severe symptoms. Call your local emergency services immediately or ask someone nearby to call for you. Remember, not every heart attack looks the same. Some people experience sudden intense pain, while others have milder symptoms that gradually become worse. When in doubt, it's always safer to seek prompt medical evaluation. As we come to the end of this video, let's review the most important points. Heart disease remains one of the most serious health challenges in the United States, but many cases are linked to risk factors that can be managed. Learning the warning signs, staying physically active, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, avoiding tobacco, limiting alcohol, managing stress, maintaining a healthy weight, getting enough sleep, and keeping regular medical appointments are all important steps toward protecting your heart. No single lifestyle change guarantees that heart disease can be prevented, but every healthy choice you make contributes to better cardiovascular health over time. Your heart works continuously every second of your life. It deserves the same care and attention that you give to every other important part of your health. If today's information has encouraged you to take even one positive step, whether it's scheduling a checkup, going for a walk, choosing healthier meals, or helping a loved one understand the importance of heart health, then this video has accomplished its purpose. Thank you for spending your time with us today. If you found this educational video helpful, please consider liking this video, subscribing to the channel, and sharing it with your family and friends. By sharing reliable health information, you may help someone recognize an important warning sign, seek medical care earlier, and potentially improve their long-term health. Stay informed, stay active, take care of your heart, and we'll see you in the next video. Thank you for watching. Stay healthy and stay safe.